Okay, I think we
There
are
you
live
are.
now. Okay. Uh, Hello and welcome to Staying on Your Feet with Diabetes and How to Avoid Food Problems. My name is Kelly Diaz and here with me is Patricia Muchero, our educator. She's a male nail technician with more than 20 years of experience. She'll be introducing herself in a minute. Right now, I would like to welcome all of you and then show you around a little bit about the platform that we are using today. If you are in a PC or a laptop, you'll find in the right side of your screen different tabs. One of them is the chat tab. In there, you can post your questions or comments. Some of them I'll be answering them. The rest, Patricia will be answering them at the end of the webinar. If we don't have enough time to answer all of your questions, we will be answering them via email. Then we have a tab called Files. There you can find 3 documents. One of them is the one that we are using for this presentation. Another one is all about diabetics. It contains important information, general information about diabetes. And we have a guidebook, a flyer for the diabetic patients. You can print it out. You can use it in your practice. It's a great small guide for the patient. You can use it just to train them and give them relevant information. For the new to our line, I would like to briefly introduce the line to you. Gebel is the world's more comprehensive line of therapeutic food care products that treat the widest range of food conditions, including calluses, cracks, blisters, fungus, sooty feet, and skin dryness. Gebel Food Care is an international leader in the food care industry for over 151 years. Gebel uses the finest ingredients, including botanical and essential oils, in order to develop its products. Gebel currently have around 34 products suitable for diabetics. Our main goal today is to give you some insights and general information about how to motivate your patient to properly care for their feet and how to detect early signs of issues that may be developing in their feet. Without further ado, here is Patricia. Hi, Patricia.
Hi, all. So, Kelly already said my name is Patricia, so Trish Michero. I am the owner of Las Vegas Medipedi in Las Vegas, and I am the keyword educator. And what we're going to do today is a little bit talk about diabetic patients or clients. How can you help them? How can you motivate them? Um, and indeed, you can do questions to Kelly. I try to answer them. I don't know everything, but I try. And I have 2 locations. One is in a podiatry office and one is here on Sunset Road. And because I'm in a podiatry office, I have a lot of diabetic clients. I do this since '88. I'm also a medical nail technician. There's a lot that I see here, and I think more and more we will get the diabetic clients because um, by the last numbers we had in the office is that 83% of patients patients, not U.S. citizen, but patients in an office have diabetic issues here in a podiatry or in a specialized pedicure place. So what we're gonna do is talk a little bit what what diabetes does to the feet. It is because, of course, the high blood sugar level and what kind of damage you can see and what you can do with it and how you can mean something for your clients and motivate them. At the end, we have some things that I use here, systems that I use here in my office, what stimulates the clients to use products, to do their exercises, and that kind of thing. So, yeah, as most of you will know, that diabetes is a sugar disease. It's a chronic disorder, and it will damage organs, blood vessels, nerves in the long term. And that is because when it's high, the concentration is high, it causes a lot of damage. There are two types, and it doesn't matter what kind of client you are dealing with. Diabetes has these causes and results for your clients, and you have to work with them. So, what do we see normally? The common things that you. Oh, we lost the video again. I'm sorry. Sometimes the connection is a little bit slow, so then we lose the video image, but we will be back, of course. So now you
But
hear
we can hear
only
you
me.
perfectly.
Yeah, you hear me, so that's good. Oh, there we are. So yeah, the common skin problems by diabetic clients are dry skin, callus wheals, foot deformities, foot and nail fungus, and inflamed skin. There are more, but this is what we see most. This is what your clients come in with. The diabetic foot, there it's called DFS, so that is a short for it, and it has a couple of clinical findings. So it is reduced sensitivity and pain sensation. For us, very important to determine that if your client has that. Weak or missing foot pulses, circulatory disorders, diabetic osteoarthropathy, and minor or major amputations. I have some clients that have amputations, and sometimes I work with clients with ghosting pains. So this is the most common what you see. Again, there are more. Um, the risk factors. So the higher sugar levels over a longer time damage all these areas in the body. And the diabetics develop neuropathy and angiopathy. Sorry when I don't pronounce it right. I'm not a doctor, but the biggest risk factor for foot lesions. 10% of all patients with foot lesions and callus or pressure marks on the skin, and 50% missing foot pulses, and 17% peripheral polyneuropathy. Now, I explain this as there are two major neuropathies: one with pain, one without pain. uh the with pain is bad. I have clients like that, and you have to be careful. But the pain factor for you as a nail technician is at least they feel what you're doing. uh of course, they are oversensitive. The other one is, in some people's eyes, a nicer one. In my eyes, not. It's the most dangerous one. It's the one where they lose feeling. So they don't know, or they don't feel, or they don't experience your hot or cold foot bath. They also don't feel splinters in their feet or any other wounds. They must have it from their sight or smell to see anything on their feet. And when I get clients here in the chair, and I ask them, "Do you have neuropathy?" and they say no, then my next question is always, "How do you know? Is that tested? Did a podiatrist tell you this?" Or because the fact, when they have the form of neuropathy, that they lose their feeling, literally lose their feeling, they don't feel pain, so they don't feel that they have neuropathy. um, they feel certain things, but it is up to you to determine. So communication with your client is the best way to go, like an intake, and have a chat with them and a foot exam. But that is the best way to go to discover, not that you can diagnose neuropathy, but to discover, okay, Do they feel everywhere? Just squeeze the foot a bit, and when they don't have feelings, refer them to a podiatrist. So yeah, for us, very important. The risk factors, other risk factors is pressure from inappropriate footwear. With with the neuropathy that they don't feel, they won't feel this. They won't feel that they get blisters. I see it here a lot. Foot deformities, overweight, obesity. Um, just read them and you will recognize them. So the consequences of all of this, so the nerve and the damage and the reduced blood circulation make that the problems with walking and the pressure and the distribution is not good anymore. They get dry skin, they get callus wheals, cracked skin, tears, inflammation, you name it. You name it. I think for the people that are here, it's all a little bit familiar with what I'm saying here. Um, the decreased sensation in the foot. So the nerve damage may impair the circulation of the small blood vessels in the skin. And the secretion of sweat and lipids is reduced. I don't know if you know it, but diabetic clients in general sweat less. That is one of the things for diabetic people. Insufficient skin circulation, and that is why the skin can change. The skin feels cool and brittle and becomes dry, and dry skin often develops further skin problems. Diabetic reduced skin circulation can cause problems such as dry skin, blood transport, moisture supplies nutrition to the tissue, and encourage wound healing. So when you don't have that, of course you get problems. And we go pretty quickly over this because a lot of this is familiar, but it is a little bit so you know and can share the knowledge why a skin is reacting like this. So here you see a little image how it works. So on the right hand side, indeed a healthier skin, and on the left side the broken skin. What we see a lot by diabetic clients, and so they lose their moisture in the dry skin. The right hand side with good creams, you can try to establish that, and you can recognize a dry skin for white, brittleness, tight, itchy, and scaling. The skin dries out more quickly in diabetics because of circulatory problems. Microfine skin cracks can serve as entry points for pathogens, and this results in inflammations. So it is the circle that you go through. They have dry skin, and because they have dry skin, they lose more moisture. The skin gets drier, and you can help with that. That is a little bit later in the webinar. So then we have the callus hyperkeratosis. We all are dealing with this, and it's a thickening of the outer layer of the skin. And it's you have the pressure from the bones and the shoes that are hurting the tissue or injuries the tissue, and it forms callus. So here is where we can mean a lot for our clients and how we take it off, and I will explain later on how you can establish that.
I would like to make just an add-on. It's part, like Trish says, part of the same circle. Dry skin. So this
Yeah.
when the skin tries to protect itself, so it generates callus. It's a
Yeah,
circle.
it's a circle, and what we are gonna try to do as our first providers, because we get these clients and we see their feet first before podiatrists most of the time, before their own GP. We're gonna try to break that circle. That is what you're trying to do. And that is what we're trying to explain here in this webinar. And then later on, we try to give you advice to break the circle in a way, and to catch your client, connect with you, and do the foot inspections and that kind of thing. But that's a little bit further. Um, Here we have the cracks and fissures. We see all of these diabetics often fail to notice their wounds because of the loss of sensory function in their feet. And inflammation may develop into ulcers. This is known as diabetic foot syndrome, so DFS. Um, so yeah, this is very important. We see them all, and we're gonna try treat that later on. We have the sensitive skin and risk of infections. So it's the skin is then itching and burning, dry and red. Diabetics are especially susceptible to sensitive skin. Since the skin is often dry and cracked, fungi and pathogens can enter more easily, causing itching, redness, and inflammation. Um, you can add a whole other range of what you see in this area. So it's not only the itching, burning, dry, and red skin. It's the scaling. It's even the blistering. What you see falls all into this. Um, and as we know, open skin, you can get inflammation, especially diabetic clients, because they don't notice anything most of the time because of the numb feeling that they have in their feet. Then corns. Round, slightly convex shape, yellowish color, callus growing in a thorn-like form towards the bone. What I always do here is, as in many states in the US, it's not allowed to use any scalpels, the cheese grater, you know it. And especially by diabetic clients, you don't want to use any invasive tools anyway. But what I do with corns, I always check them with my thumb by pushing over the corn, if it is a corn, or if it is only a callus patch. A corn is easily recognized because when you go over them, you can feel that there is something in the middle. So that is the thorn-like form that goes towards the bone, what you feel. Most of the clients that still have feeling will react to that. It will hurt them. What I do is I literally e-file it. I don't go that far that I draw blood because it is a podiatry issue. But I e-file so they lose a lot of the pressure. The cause is most of the time poorly fitting shoes, and but also like people with drop foot or that kind of thing, where the bone is literally they're walking on their bones, so the bone is lower than normal. Uh, it can be very, very painful, and a lot of diabetics suffer from deformities. So, of course, that doesn't help. Increased callus and pressure are responsible for corn formation. Loss of sensation in the feet alters the gait, and pressure spots and callus form, especially if the toes don't fit properly. The consequences are corns. So, yeah. Then we have the ingrown nails. A little bit about ingrown nails. There, a lot of my clients come in and they say, "I have an ingrown nail." Um, Here in the state of Nevada, I don't know about other states, but a lot of states have the same thing. We can't treat ingrown nails. That's a GP or a podiatry thing. It goes out of our scope. But a lot of nails are not ingrown, they are impacted. And what that means is the difference between ingrown, where the nail goes in the live tissue, that's an ingrown. And you can recognize it by inflammation on the nail edge, open wounds, the proud flesh, so the flesh that is going up, and often on the big toe, and of course the pain. An impacted nail, however, and that is what we see a lot, is the nail is laying in the nail fold, and there's a lot of skin going on there, and that is where we can help them. There's a lot of pressure. There can be a little bit of pain. Your client says that's an ingrown. It's not an ingrown. It's an impacted toenail. So that is the main difference. The causes is an incorrectly fitted shoe and, of course, too much pressure. Excessive sweating promotes ingrown toenails by softening the cuticles. And additional causes of ingrown nails is changes of the foot arch and or toes. Think of indeed losing the arch and walking more towards the toes. We have seen it all. Um, and incorrectly trimming. For diabetics, inflammation can quickly become dangerous, especially if it's not noticed due to loss of sensation in the feet. Then the risk of wounds arises. So yeah, and when you see, and there again, that is why I said the neuropathy, for example, that they loses their sensation. When you see that that nail is inflamed, or there's any redness, any pressure going on, and they don't feel it at all, that is a reason to check it out, what their feeling really, really is, because they should feel something like this, because it hurts. It really hurts, even when it's only skin, what is under there.
Would you
Then we
recommend to go to the doctor?
Yes, when it's impacted only, sometimes you can get the skin out of there, so you clean it up with a skin softener. What I do here, I do the Kiwol skin softener on there with a little bit of cotton. I wait, I do first the rest of the toenails, and then I try to get the skin out. As soon as it is really ingrown, that you have to refer them, because you can't do invasive procedures at all. Sometimes I also have to refer the clients that have too much pain, even though it's impacted, because that are the people that have increased sensitivity. So I refer those two. I work here together with Dr. Larkin of Larkin Foot and Ankle Institute, and he does that then for me. And after that, they return for their normal regular pedicure where I treat it. But yeah, softening the skin. So with a little cotton ball, with a skin softener on there, and then try to remove it. And we go to foot and nail fungus. So, diabetic people are more vulnerable for fungus, and because they have more skin problems and infections may spread. When foot fungus is suspected, they have to go to the podiatrist or the GP. You can recognize it because of the itching of the feet, the redness, the scaling. The nail is dull, cloudy, non-transparent, small white spots, and yellow-brown discoloration and unnatural thickening. We all see it as nail technicians. The cause is that the skin barrier is damaged and the skin loses its protective mechanism. Dry and sensitive skin is especially susceptible to infections such as foot fungus that can easily cause infections. So most of the time it's first on the feet that you see that the skin is going, and then indeed you see it also on the nails. Most of the time, by the way, the big toe. Then the diabetic foot and our role in that. So most of the time we are the first contact. They come, especially by me. I don't know how it is by you, but especially by me, people look me up or come here for a reason. They already have a problem in my case. I don't know how it is by others, but I see a lot of diabetics in general. So you're the first point for education, for trying to explain to your client how important it is, how important it is to have this knowledge and to motivate them to take care of their feet. Foot care is often forgotten. It is literally, I'm always amazed about the fact that I get clients here that easily spend $100 to $180 on the hair, and when I tell them my pedicure is $65, that they have something like, oh wow, and I have something like, yeah, but this is what keeps you walking. So I don't say that, but we deal with this. However, I have a nice client base and they are doing very well, and I always try to motivate them to do their foot care. And in a way, almost everybody's picking up on that. Some fast, some slow, but I do try to motivate them. So yeah, our role as diabetes consultant. Now, of course, we are not a diabetes consultant, but what I mean is it is important to have the knowledge and to try to help your clients. Here, I have indeed patients or client records. I do an intake. My first time clients, I do an intake with, and the first thing, my first question also is, do you have diabetes? I always look for my returning clients, what I did before. I look in the records and what I did, and I look at the results. I pay not really a greater attention to hygiene, but you can do that. You can make a difference between your normal pedicure and your regular pedicure, because what I do here, in a way, all my clients get a diabetic pedicure. I just switch totally. And so, yeah, I don't use invasive procedures in general. Um, I don't use pointy kind of instruments, and I don't nip the cuticle. I file the cuticle. I e-file the cuticle. I push it softly up and I e-file it. I give them tips what they can do in between appointments, and I try to get them to do what they have to do to keep their feet in a good condition. So yeah, do use the cream. And when they ask me, does this really help? Yeah, when you get it out of the tube, it helps. But you have to get it out of
Oh,
the
I
tube
must
and
do
not do it
it.
once a week, you know?
Interesting.
So that is what I try. Then I document what I do. I make befores and afters, not only because it's the internet and because it's fun, but also for myself and to see how the development of the foot care goes over time. It's fun for the client too, because sometimes I literally turn my phone and I say, do you remember this? This was a half year ago. So I show them also the progress of what is happening. Uh, preventing. Preventing and maintenance is the most important thing. So diabetics have a high risk of follow-up diseases due to consequences of long-term elevated blood sugar levels, especially for neuropathies and angiopathies. The problem is that diabetics often don't notice anything on their feet, on the leg in general. The reason is lack of problem awareness and compliance on the part of the patient, neglected foot care, and low education in the context of diabetes training. So that is where we try to change that by a client. The DFS can be avoided by prevention. So the daily foot inspection, very, very important. And I must admit, not a lot of my clients are doing this, and I'm trying to get them. Uh, about one third of the diabetics still don't know that they have something to do with their feet. Um, as soon as diabetes is diagnosed, every patient should receive training and learn about their keeping their feet healthy. The reality is that less than half take part in any training. So that is where we can try to educate them. And later on, a couple of tips how I do it over here, but that is a little bit further. So the daily foot inspection. It is as important as brushing your teeth or a shoe stocking check or foot check. So it takes 14 days to create a habit. And what I do here, I tell clients here, okay, this is why you should inspect your feet. When you have something in your foot and you don't notice it, you can get an ulcer. You can even lose one of your digits, even worse, your whole feet or foot at that point. Patients should examine their feet and soles for redness, pressure points, swelling, blisters, cracks, foreign bodies, and injuries. And what I show them here is how they can check that, for example, with a mirror or their phone, because I have a lot of seniors. I bet you have a lot of seniors, and they're not that flexible anymore, or their sight is not working anymore. So I will explain how I do that here. And if they don't have anybody around them, because I also tell them as family, friends, people that you are living with, uh, then they should start asking and reaching out for this, just to get not any further damage. So, how do I explain that to my clients when they immediately say, when I say, okay, check your feet, and they say, I can't bend, I'm not that flexible, then I advise them to sit on a chair and put a mirror on the floor and hover with their foot above the mirror. Now, that only works when your sight is good enough. There's another option, and not everybody has a mobile phone, but a lot of my clients have. And what I say then is put your phone on video, put it on the floor, hover with your foot above the phone, and then pick up your phone and look at the video. So that's a way to do it. It's uh, it's funny. First they laugh most of the time, and but when they return, there is always a part of my clients that say, I did that. It works. So yeah, stimulating to do that. Every client that you get to do this is one step closer to prevention also.
It's like
So
we talked the other day. It's about creating a discipline. It's about giving them the tools and all the time
yeah,
reminding them that they have to take care on their own
yeah,
at home, and like you said, find a way to have that reminder at home that they have to
to
look
create
at
a
their shoes,
habit.
look at their
Yeah.
shoes. Yes.
Yeah. So clients that when they say to me, "Oh, I forget," and blah blah, and then I ask them, "Do you do something every single day?" Think of a moment in the day that you most for the most people it's brushing their teeth. Sometimes funny thing comes up. They said, "Well, doing my teeth in." So, because I have a lot of elderly clients, so what I say at that point is put your cream next to your toothbrush, next to your teeth, if you know, if you have dentures. So put them there. If you have a glass of wine every evening after your dinner, put your cream by your bottle of wine. It's just creating a habit that they are starting to do this and also starting to enjoy it in if they can, but yeah, getting in the habit, getting that it is normal to do these things, and getting away also from part of embarrassment. There's a lot of embarrassment going on to take care of feet. So here you can read a little bit. I'm not gonna mention them all because we know it. We are professionals here, but here is a little bit how you do a shoe and stocking check and what you can discuss with your clients, what they can do, and how they can see or determine certain things. So on the left hand side for the shoes, you have to check, do the toes touch the front of the shoes or the upper of the shoes? Are the seams okay? Is the shoes properly formed? Because sometimes you already can see when the shoe and the sole is not equally filed off, they are already having problems with their gait. On the right hand side, you have stockings and shoes. Stockings and socks. I'm sorry. Stockings and socks is a funny thing because a lot of people don't know, diabetic clients that I get here, that socks can be wrong. Socks can be too tight. When I see clients here in my chair and there's an indentation of their sock in their leg, that sock is not good for diabetic clients. It squeezes off their blood circulation and they lose feeling. They damage nerves with that. It's a sock made of synthetic fibers, etc., etc. You can read over this. In all cases, the socks or the shoes are not for diabetic clients. Then we have the foot check in general, that is important. So there's a whole list what you go over and what you can advise your clients what they're looking for. But this is also what you are looking for. If you see anything out of the ordinary, they need medical care of a foot care professional, podiatrist. And on the right hand side, you have the skin. And that is where we come in. If you notice anything, what you see here on the right hand side, the itching, the burning, anything, tears, callus, warm, dry, that is where we can mean something for them with home care, with cream, with oil, anything you can think of what you can give them home. So yeah, left hand side, look at their feet and toes. Anything out of the ordinary in this list, they have to go to see a podiatrist. Right hand side, that is where we can mean something for them with moisturizing with a foot cream. So the foot inspection, the foot check between the toes. It's funny. The toe between the toes is a lot forgotten, and as some of you here will know, you can find a lot between the toes. But and I don't know if anybody here heard of toe flossing, but that is one of the things how I start my pedicure here. But for this part, if you see anything, what is on the left hand side, so injuries, so the skin is wet or white deposits or is itching, that is probably maybe athlete foot and they have to see a doctor. Then for the nails, if you see anything what is on the right hand side, the thickening, the break, the colored white or yellowish, any changes, structural changes, and is the lateral nail wall inflamed, so think of red or swollen up, then they have also to see a podiatrist. You can read over it. Then the regularly remove callus. So that is where we come in. Of course, we smooth the callus out. You can't remove it all because of the sensitivity of the skin. But please don't use sharp tools like callus planes, metal rasp, knives, and razor blades. You use sandpaper, callus files, the natural pumice stone that is pretty fine, and fine callus sponges. I here have literally no problem at all to take callus off. But I use the callus remover. So I do waterless pedicures because, like I said, I switched all my clients to a diabetic pedicure. So all my clients and all new clients start here with a waterless pedicure. And there is something that I have that is the keyword herbal antiseptic foot bath. And in the morning, I take a little spoon out of that, make a big bowl of water, soak my towels in there, and my towels go in the towel warmer. And when my clients come in after their foot exam, after disinfection, after the toe floss, I literally do them in the hot towels, and the herbal anti-foot bath in a way softens the skin already. And then I also have the callus softener, skin softener, and it literally, you just file it or you scrape it off. It's half of the work. um, the excessive callous people with cracks and that kind of thing, I start out dry, filing and smoothing dry, by the way, just also to determine if the lesions are not in the live skin. So yeah, I don't use sharp tools at all. And I remove the callus for my clients, and I show them, like the file that you see over here, that they can do at home, a little bit of smoothing in between. So I advise them, do this once a week, twice a week, 3 times a week. It depends a little bit how their skin is. The softer the skin, the less they do. Then it comes down to moisturizing. But yeah, this is my advice to my clients.
But it's always recommended for the diabetic client to have their callus removed by a
Yeah,
professional,
yeah,
right?
yeah,
They can
indeed.
do it by themselves, but due to the neuropathy they may cause.
Yes, yeah. I like I said, I take it off for them, as far as about 73%, and most of the time my clients are they come in monthly, and most of my clients don't file themselves. I have, of all my clients, I think maybe 8 about this that file themselves a bit, and that is because they have excessive callus, but they have the hyper keratosis in a bad form, or they have a chronic form of athlete foot that hardens up, and they try to keep up with what I'm doing. But most of my clients cream. That is what most of my clients do. So I remove the callus. They cream when they are at home. So to prevent foot problems, diabetics should apply products to their feet every day. Does it help, Trish? Yes, when you get it out of the tube. So please do it every day. I rather have that they do twice a day, but I try to get them at least do it every day. Like I said, creating a habit. Moisturizing emulsions with urea are recommended, and they strengthen the skin barrier function and protect against dryness and excessive callus. So here you see one of the items, and I didn't put my items out, but I do
Just a
have it.
note.
I do have,
Just a
huh?
little. Just a little note before you start with the products. We have around 34 products suitable for diabetics. During this presentation, we are just only going to show you, I think, 6 of them. The most recommended for the most common problems. But in the catalog, in the professional catalog, you can always consult if the product is suitable for
Yeah.
diabetes. And so yes, these ones that you are going to see that Trish is going to talk about are the most recommended for the most common problems.
Yeah.
But
The
that
most
doesn't mean that
used.
they
Yeah.
are the only one.
Yeah. So yeah, and when you have any questions in the meantime that I am talking, you can you can post your questions, and we try to answer them. But yeah, so this one, let me show you. This is the rehydrate, heat dry. Wow, I lost my train of thought. Rehydrating for the dry skin doesn't matter, happens a lot. And it is the keyword
Moisturizer.
yeah,
I have the
lipidocrine.
same problem.
Yes. So it contains 10% urea, and it moisturizes the deeper skin layers. You can read what it all contains here, and it has no silicones, PEG emulsifiers. It's unscented. It's rich in texture, and it is intensive and long-lasting care. So this is a very good moisturizer. I advise this to my clients to use it every day, and it has anti-inflammatory properties, and it reduces any pressure marks and callus. So, um, and then we have this chapter, and that is fun because as professionals, we know that in a way we shouldn't cream between the toes. This because it makes increase the germ density and the bacteria grow because of the warmth in between toes. However, this one is a cream, and studies has um, uh, it creates
So,
an illusion. It does not create the bacteria in between the toes. So therefore, according to the study of the authors, it can be recommended to use between the toes unless the dermatological therapy is generally required. What I do, I cream indeed with this between the toes. I don't do much, just a little layer, and with other creams, I don't. I wipe between the toes always clean because of bacteria forming, because of the warm environment. So yeah, you can use this one in between toes. So this makes this one different from all the other products. Then the Express Foam is a moisturizer too. It is for daily care, and it has evening rose oil that strengthens the skin barrier and supports a natural skin moisturizing balance. It's very nice. When I use it here, I make a little ping pong ball on my hand and rub it in and do it over the feet. It's fast. It contains 3% moisturizing urea and avocado oils. It protects the skin, and it stimulates cell regeneration. Um, it's not greasy at all, so it absorbs very fast. And again, it's unscented, without parabens, silicones, and PEG emulsifiers. I
and easy
like,
to apply, right?
huh?
Easy to apply. It's easy to apply, so it
It's
will be
easy to
helpful in
apply.
us,
Yes. Yeah.
clients with sensitive skin.
Yeah, it's very easy to apply, and like I said, you just make a little ping pong ball size foam ball on your in the palm of your hand, and I never rub because but I do this, and then I apply it all over the feet, and it's done. It's very very nice. By the way, all the products that you see are, of course, suitable for diabetics. But like Kelly said before, you see it in the catalog what every product says, what it contains, if it is suitable for diabetics, etc., etc. So then the callus cream. This is one of the best one in my establishment here for home care. People always use, because I try to educate them, what is this, what is that. They know I'm very open about that. They know I sell my Gewel products, and this is the one that is very nice for maintenance after they had pedicures and you have removed the callus. So it's a care complex with urea, 18%, glycerin, elantron, and avocado oil. It loosens the cell network of the hard outer layers of the skin. It moisturizes, it increases flexibility, and reduces callus. The normal corneal thickness is after 28 days. So it is not a product to just use one time. You have to keep on using it. And the results are very nice. You get a silky kind of skin that is flexible, and it smooths the skin surface. It is without silicones and PEG emulsifiers, and again, it is for intensive and long-lasting care. Only apply the cream to the affected skin, not the surrounded skin. So very, very important. I don't hear you, Kelly. We don't hear you.
Grace?
Yeah, now I hear you.
Okay, I'm sorry. Judy is asking, I think it's an important question. She's asking, do you apply both the express foam and the Lipidro? I think
Um,
there should be established a difference.
yeah, no, it depends on what kind of pedicure people have here. It's a little bit also up to you, but most of the time I use the express foam. It's handy, it's fast, it's I don't know. I think it's a system that you develop in your own pedicures, and but I do have longer pedicures. So in general, my pedicure is an hour. I take the time for my clients, and but I have clients that need all that extra, and then I do the Liprido cream, and I do the express foam. So then yes, I use multiple creams. I like also what we don't have in this webinar, the leg vitality, for example, with avocado oil, what gives a lot of flexibility. So it depends on your client, and it depends on what kind of pedicure. So define the clients that have a very, very dry skin, the clients that need that extra care where you moisturize multiple times. Um, there are, and that is, by the way, nice that you asked, because my clients, most of the time, they go for a cream to take home and not a foam. No idea why. There is no explanation for it. I think it's preference, but they go for what I use. Only the
Uh,
phone. Yeah, I explain also why I use it. So, and when they feel that it works, they ask for it, and that is where your first home care starts. So define how dry is the skin of your client. When I have to moisturize twice, yes, I use the Liprido and I use the foam. I have even big bottles of foam because I use that a lot because it's fast. But in my longer pedicures, I use 4 or 5 creams, and people are paying for it. They do. I have
and then
so
there is also an important difference that Lipido has more urea. It has
yeah,
10% urea, and the foam has 3%. So that's
yes,
another thing to consider when you
yeah,
choose.
yeah,
So maybe we can say that foam is uh, faster to absorb,
yeah.
quick to
It's quick.
apply,
Yeah,
and then Lipido it's ideal to prevent callus
yeah.
and ideal to take home.
Yeah, the
Maybe
the
there's
the
another thing
thing
to
that I
consider.
like to also use a cream is because I massage it in, so your blood circulation will go more up. The foam is very fast. The foam, you apply it and you massage it in, and it's done. It's non-greasy, and the moisturizing goes faster. However, with a cream, you can do literally a mini massage, so that stimulates, of course. And like what Kelly said, the difference in the urea. So yeah, decide which client needs what, and that is what you advise. Very dry skin, I do double, and even three double if I have to. And fast clients with less dry skin, I only use the foam. So that is for me the difference. But that is my system. We want to make later on some videos how I do my pedicures, so you can have an idea how I do it and then make your own, for example. Uh, yes, so back to the slides. And we were over here. That's another one. And this one is lipid lotion, suitable for diabetics. And this one has 10% urea. It has allantoin and avocado oil. It's easy to distribute lotion for daily care and dry skin on the legs and feet. There's a whole list again, with ingredients and what it does. It gives the skin some softness, and it reduces new buildup of callus, and the Topiaco starch leaves a silky and pleasant feel to the skin. So this gives a nice silky kind of feeling to the skin. It's vegan and gluten free. This is the only one that I don't have here. I did my order out this morning, by the way. So, but yeah, that is the moisturizing part. Up to you what you're gonna use for your clients. Then, in addition to the blood sugar measurements and strict diet, diabetic patients also can take care of their feet at home with foot baths. Um, Many find it difficult, but with the right feel-good approach and motivation and compliance, it can be increased. So, the foot baths in general, like I said, I do waterless pedicures, but that doesn't mean that I don't have foot baths. I have here the warming bath, and I have here the herbal antiseptic foot bath. The herbal antiseptic foot bath is my favorite. It softens already the skin. That is why I do it in my hot towels. But I do have a balava ball here too, for the clients that can have a foot bath. Um, the advantage is that diabetics often suffer from circulatory disorders, which are the most common cause of dry skin. Foot baths promote circulation and strengthens the sensation and feeling in the legs and feet. The circulation accommodates the transport of moisture in the skin. The absorption of the skin increases, so does the amount of nutrition in the bath and care products that penetrate into the deeper skin layers. So yes, you can do on diabetic clients a foot bath, but I always advise do the foot bath before you start your pedicure. That takes away the hazard of infections with 86%. So going back and forth in the water while you're doing a pedicure, that is where the infection hazard starts. There is something, and it's called mycosalon trauma, MST. And what it is that when you scrape yourself or you scratch yourself, when you shave your skin, think of shaving a beard, and you use on that aftershave, you go like, it hurts, it hurts, and that is because after shaving, after scraping, after scratching, your skin is open. Even though you don't see blood, your skin is open. That is mycosalon trauma. That is for diabetic clients a big hazard that they can get an infection. You can be as clean as you want. This is exactly the reason why podiatrists don't soak their clients, because they know the skin can be open. So when you do a foot bath, do it before your pedicure. It makes the skin nice and soft, it makes it flexible to work with. I do it with my hot towels. I use the foot bath or the foot bath water to soak my hot towels. So it's not that they don't have the water bath at all, you do it differently. Um, so try to avoid that. When you are filing their nails, when you are cutting the callus off, you are causing microsalon trauma. You can't avoid that. That's what a pedicure is. You're smoothing. It's nothing bad. It's just something in daily life. But for diabetic clients, it can be an infection hazard. So, so what? The little bit the rules here about the foot bath. Don't bath the feet longer than 3 to 5 minutes. So you do a short soak. Just make your pedicure a little bit longer to give the people the relaxing feeling. The bath temperature should not exceed a maximum of 97.6 or 100.4 degrees Fahrenheit. Be careful to dry the feet after the bath. Just pat them dry. Don't rub. Pat them dry. And also between the toes. Take a cotton swab and just wipe softly. And after that, you apply the special cream, or you tell your client, of course, they can apply the cream, the Kiwol Matte Lip Pro cream. And it's urea friendly again. It stabilizes the hydrolipid barrier, and especially sensitivity for diabetics. So yeah, that is the foot bath that you can advise people to do home, but also how you can do it in your own establishment. Here you see three examples of foot baths. I have a couple of them, and I even have one that is not on here. But like I said, there are a lot of foot baths available. You have the soft feet one that I use for my spa pedicures. You have the bath salt, and then you have my favorite one, the herbal foot bath. That is mild antiseptic, and it helps with the rough skin. It gives a nice soft skin, and it helps with foot odor. And the other nice thing is, your establishment will smell amazing. It will smell amazing. It's a very relaxing one. So these are available. You will find in the catalog a lot more available, and it tells you exactly what it does. The right nail care. So the sniper tip of scissors increase the risk of injuries, and I will tell you in a little bit why you don't use scissors. And there's also a way how you can hold the toes to not get any wounds. So indeed, wounds could flare up, no longer heal, and lead to DFS. And diabetics should file their nails to prevent ingrown nail corners and avoid injuries. So trimming the toenails, pointed instruments are out of the question. I do here literally, and that is what you see in a lot of diabetic pedicures. I literally e-file almost everything. You get handy with it. So do not use pointed sharp instruments as scissors and nail clippers, and trim the toenails with a sandpaper file or a diamond file. Make sure that the nail finishes is parallel to the tip of their toe or their own toe when they do it themselves. Just show them how you do it. Um, Rounded nail corners increases the chance of inflamed nail bed and painful ingrown nails. So indeed, where you get that whole corner away, because that nail will grow, and you will have a spike that goes in the nail wall. Care for nails with a special nail and skin protective oil or nail and skin protection cream to prevent against nail fungus. A little bit about the pointed instruments. A lot of us, also me, we all started out with nipping the cuticle, with cutting the nails. Um, and you have to know, I have, or in general, diabetic clients who have nerve damages. can have ticks. And I don't know if you ever noticed it, but if you hold them and you are trying to cut a toenail, suddenly they have like they just have a tick, and that is our damaged nerves. Not all diabetic clients have that, but it is something what could occur. So that is the risk that you can cut them with whatever you have in your hands. That is why you shouldn't uh, use sharp tools. Uh, Whenever that happens, when they have a wound, they don't heal properly. They are diabetics. They heal slower. And it's not even that your tool makes that infection. The fact that they heal slower, they go home, they walk on their bare feet, uh, they wear their socks twice, 2 days after each other. It doesn't have to mean that your tool was dirty when they get an infection. They get an infection because their skin is open. Not all diabetics, don't get me wrong. They can get an infection. So it's not the fact that that your tool maybe was dirty. No, it's the fact that you opened their skin. They are vulnerable, and that is why you try to stay away as much as you can from uh, sharp tools. So uh, I try. Sometimes you do have to nip, don't get me wrong, but you try to stay away from it. So, and then for indeed the nail care and the compliance with athlete foot and nail fungus, there's a protective nail and skin oil for that. It takes several months to over a year for a new nail to grow back and healthy and free from fungal infections. To protect healthy nails, an antifungal nail oil should be used for the entire duration of the nail therapy. This is the one that I always advise to my clients, and to use on their nails for nail therapy and for not getting any fungal infections. The consistent nail care by a professional is preferable for diabetics. Foot hygiene is the best protection against fungal infections. Applying a special foot care cream daily stabilizes the skin barrier, and after showering, the feet must be properly dried, especially between the toes, and with a cotton swab to not do not too rough. And socks and shoes should be changed daily. Shoes should be also be disinfected regularly with the shoe deodorant. Um, I try to make my clients aware of have two pair of shoes. One you wear when you do it in the evening out. You use a shoe deodorant before and after, and you just wait. And then the other pair you wear the next day. Not everybody like to do that or wants to do that, but try to say, okay, this is how you properly do it. um, and you hope that
Um,
that they will, by the way. um,
Excuse me, Trish.
mhm.
There is a question related to the trim of the
Yes.
nails.
Yeah.
Jerry said, I have always been told to cut the toenails straight across and to round the corners with a file. Doing that actually causes ingrown?
Yeah, I explain. Now, of course, I don't have an example. Okay, so with the rounded corners, the way it is meant here, you indeed round the corners. You get the sharpness of the corner. So the sharpness of a corner away, and that is what is meant with the round corners. That is indeed what we do. That's good. But you see also, and what they mean in this webinar, the description is they round it totally off into the nail fold. That's wrong. You get spikes, and that spike will grow in the nail fold. So rounded corners is meant the way we file it, that you file the little point off there, but not the rounded corner totally in the nail fold. And then we lose the video. Dang.
But I
So,
think it's
but
clear. I think that
yes,
your the
okay.
point that you
I
made is
hope so.
clear.
Yeah,
Yeah.
yeah. So indeed, that is meant with the difference between where they use rounded corners and rounded corners. So you file flat, take the little pointy things off, but not totally in the nail fold. That's the difference. I hope that answered your question. And I explain again if you want me to. So just let me know.
I think further questions and if they want more information, we should do it after the webinar because, as you may understand, this is a very complex topic, and right now we have in 1 hour 10. So maybe we're hoping
Yes.
to wrap it up a little bit, and then
Yeah, the
but after
fun
the
part is at
webinar.
the end. The fun part is at the end.
But yeah, you did say great explanation. Thank you. So I think it's clear.
Yeah, yeah. And also, we are going over this as much as possible. We even shortened this because there's so
Hmm.
much information, and for a lot of
Yeah.
you, you already know this. But if you have any question, you can always text me or Kelly. You can leave me a message or send me an email. I will answer. Sometimes it takes a little bit longer. I am very busy here. So yeah, we go to shoes and socks. So 30% of the diabetics wear unsuitable shoes. And the most common reason, that is the most common reason for pressure spots. Um, and if they notice that too late, they can get ulcers. I think it's even more than 30% here in my office. But and especially in Vegas, people love to wear the flip flops and their sandals and good shoe wear. I always try to get them to good shoe wear, but it's hard. So I leave it to Dr. Larkin and say, okay, ask Dr. Larkin because a doctor. I think can do more in that area than me when I can't convince them. So yeah, the ideal shoes for diabetics, you have to have enough room in height and in length, by the way, and a heel no more than 2 inches. Uh, a soft upper, not too hard cap, so the nose of the shoe, and no protruding seams that cause friction, and a smooth inner liner. The individual rigid construction of the soles permits a stable roll and process and prevents excessive movement in the shoe. So indeed, the moving in the shoe is bad. They are literally filing and causing friction on their soles. The shoe should be stable and surrounds the heel that the foot is firmly seated. But like I said, it's hard. So when they have already certain issues, there are ways to relieve pressure. And you have this special diabetic insoles. It distributes, wow, the pressure. And you have the diabetic safety shoes for diabetics who suffer from neuropathies and circulatory problems. You have the pressure relief shoes. It relieves pressure from the areas around ulcers and pressure relief cushions. Wow. Made from polymer gel. I love those, by the way, because it's nice. It's soft. It's elastic. And it adapts to the shape to reduce pressure. And you can find them, by the way, also in the catalog.
And in the website, you can
Lots
go
of them.
there and find all the
Yeah,
information about the polymers, gels, and bandage.
yeah,
They are awesome. They are great.
yes,
And then, like I said in the chat, you can always call us, and then we'll provide you with all the information that you require.
yeah, yeah. Now, the fun part, motivating your clients. There are a couple ways to motivate your clients to keep mobile. So, my first thing to motivate my client is say, okay, do you want to be independent of somebody or do you want to keep going? So this the way you're going now, you will get independent. There's no running around anymore. So that is my first thing. For a lot of people, they are sensitive for that argument because they want to stay independent. So the other thing, and it's a little bit a shame I couldn't find it, but there was a study about this and about a nurse who did this in a senior home. Give their feet a name. Joss and Ava are doing well today. It's funny, but it also personalizes things. A lot of people feel embarrassed about their feet. I have here a couple clients that I literally ask how the bad boy is doing today. So it connects. It connects straight away. People have a laugh about it. So yes, that's a good one. So try to connect in that way to your client. It personalizes your pedicure and they are more prepared to listen to you and to repeat at home what you are doing. So do proper home care. Be proud of your feet. So buy sandals in the spring, and I always try to be a little bit upbeat about it. And when people leave here, also, there is a saying that, okay, bye bye, see you next time, and go and buy some sandals or go and show the beach your toes. So the whole upbeat thing helps them to get over an embarrassment. I also tell my clients when they say, "Oh, my feet are bad," and, blah, and I say, I've seen worse. Don't worry. I've seen it all by now. Of course, I didn't see it all. And of course, uh, it's not all bad. I do get my share because I get the patience of the doctor, so, and he knows what I can do. So, but I always try to lift up my clients and comfort them in the fact you're not the worst case I have. I don't say that because you don't want to put them down, but I try to ensure, you have something to be proud of, or you're still walking around. You still, as a diabetic, have all your 5 digits on your feet. Take care of it. Don't lose one. So, uh, the upbeat chat is what I do. The welcome feet can be shown off. So go to the beach, show your polish, um, and I tell them take care of them like you do indeed for your partner, your friend, your puppy. It's your independence. Take care of them. And then indeed set up the special corner in your bathroom or living room to remind you of your foot care. So I go very quickly in my chat with my clients. So communication is everything into what do you do at foot care at home? Well, most of the time it's, well, nothing. I'm not flexible. I don't have time, blah, blah, blah. And when you question more, you find that they have certain habits. And I try to click into that habit and to let them do their foot care with ever what they're doing. You have, I have literally people that do Bible studies at home. Do it under your Bible study. Sit down, cream your feet up, do some nice socks on or whatever to make it nice and warm and let the cream soak in while you do your Bible study. So connect with your clients and they will do it. They will start doing it. Maybe in a slow progress, but they will. So developing feeling for your feet. What I it's funny because I try to get people to do more also towards each other. Like what you see here, the blood circulation is boosted with a foot massage. I try friends to get to do them that with each other. Um, I try seniors that live in the same home to check on each other and to do foot care by each other even. Not always works, don't get me wrong, but when it comes to trying to get my clients to do home care, there's nothing too crazy for me, literally. That I don't know why, but I am a big person on home care. It makes my job easier, it makes them keep on going and preventing from further damage. Um, so I tell them what they can do. They can massage each other's feet. They can go to a professional for massages. And then the exercising, the baths. Take a bath. Why should you watch TV every night, the same soap, and not take a foot bath in the meantime? So stimulate them to do things. Give them some fun facts, and that is what is important, how we can mean something for them. The products they take by you. Okay, so yeah, this is fun because this is literally what I did with my practice here. You decorate a nice area, you dim the lights, you have calm and relaxing music. um, I do indeed blossoms in the water when I have a water pedicure. I call it here soap pedicure. I don't have much soap pedicures again, but when I do indeed blossoms in the water. Get a beverage ready. Well, this this is kind of funny because they say a cup of herbal tea, a hot chocolate. Well, we have here, I tell all my clients and I ask all my clients, do you know the boost trick? And of course, the answer is no, uh, because they don't know the boost trick, because it's something that we came up here with in over time. So what that is, I tell my clients, take two baggies that you can do on your feet and take two pair of socks, and then you do a little bit of cream, the Liquido cream or any other cream, like I like also the Leg Vitality, and you wrap it in the baggie. Then you do the baggie in the microwave, and just for a couple seconds to warm it up. You do it on, you sit down, you do it on the feet, the socks over it, and you enjoy your wine, your margarita, whatever booze you want. And we call that the boost trick. They have a laugh about it, but they do it. And that is my purpose, is that they do it. And they remind to do this. So find your way to advice. Then train your feet, exercise. Um, I show people how they can exercise their feet here. I give them those exercises at home. It's even that now in my Las Vegas Medi-Pedi group, I start for my clients exercising. So they can see how they can exercise their feet and how to stay longer mobile. So these are a couple of exercises that you can do with them, and they are sitting in a chair, and make always sure that safety comes always first. In everything that you do, safety comes first. So I always let my clients sit down and I show them how to use their feet or the exercises that I give them. So indeed, the pointing outwards, pointing inwards, pointing down, pointing towards you. This is how dancers and ballerinas keep themselves flexible. So here you see a couple of them. There's a whole range. You can look them even up on YouTube. But yeah, lift your knee towards you and let them stretch the toes toward them. For the extra still flexible clients, you can indeed say, put your toes towards you and pull a bit. Not too much, never too much. And this can also be done with both legs. Uh, the claw and then the stretch your toes ones. So they always have to laugh when I show it with my hands when I'm doing the pedicure. And I said, you should do more exercising, because a lot of people at one point they get the hammer toes and the disformed toes, and they lose also feeling in their toes. So you want the blood circulation up. How you can do that is indeed show them the towel trick with the towel on the floor, and they have to grab the towel towards them. Don't forget, always also do the one that is pushing away. Then you have the ones that grabbing a marble, pencils. I have here bets going with clients that I say, let me see you do the next time when you come in, if you can pick up a pencil or the marble or the golf ball or the handkerchief, whatever. Dare them. And they will do it, as long as you get that trust with them. um, I try to explain the part where they should take care of themselves and that they have to set goals. Like I said, I send them away with, the next time that you come, show me that you can pick up a marble. So yeah, that is that is my system. You will find your own ideas and your own system. That is why we are talking here, or I'm talking to you, to give you the ideas, the tips. You don't have to do it like others are doing or like I am doing, but there are so many things when you think about it, how you can bond with your client to proper foot care. Create a food meetup. We literally have them here. I let people, of course, now with the whole pandemic thing, it's a little bit harder. So because of the distancing and that kind of thing. But yes, we're gonna do that online with my clients, the food meetups now. So meet up, check each other's feet, do some exercise together, have fun, drink a coffee, and it is fun to do, and it keeps you going. Um, so for every month with daily foot care, fulfill you small wishes, and sometimes as a big wish to achieve your care goals. The way I do it here is when they do certain things and when they are really into it. I have some clients that are really, really into this. Um, I give them an extra massage, but you can also say to themselves, set a goal for yourself and reward yourself when you can do it. So that is a little bit in small. This was a huge webinar that we made very, very small, about staying on your feet with diabetes, and how to avoid foot problems. I hope you all that the information will drop in. A lot of things you probably already know, but I hope that there was something that you can use in your practice salon or office. And if you have any questions or ideas, we like to hear them. And this was again one of the webinars that we provide, and that's about it for me at this point. I don't know if there are any questions further. Then
I
shoot.
think we, yes, this is the space. If you want to make a question, please post it. I will give it 5 more minutes if you agree, Trish.
Oh yeah.
And then I think we'll finish. You did great, Trish.
Well,
It's a really long webinar.
Yeah, well, for people that don't know, this webinar was huge with a lot of medical stuff, and I had something like some words are harder for me to pronounce. I'm from the Netherlands, and so in English the pronouncement is different, and it was huge. The first times that I tried this, it was 2-3 hours, and I had something like this is just too much. Let's simplify this. And I think also we are here as professionals. Most of you have a knowledge already because of your interest for foot care and diabetes. So a lot of things that I just skipped now you can read over. So and I hope that you get ideas out of this, how you do it. Um, Maybe you want to change your pedicure scripts, how you do your pedicures, and improve your pedicures if there is improvement possible, or if you want improvement. So I think we could help each other with these kind of things. So yeah, it's it's a little bit different for everybody, but what is for all of us the same is the fact that most of the time we are the first providers to people with diabetic foot care before they even go to the podiatrist. So that is why I think it's very important that you have as much knowledge as possible and as much ideas as possible. So
Yeah. So that way you can provide your customers with
yeah,
as much
yeah,
as much information as they
yeah.
can,
And also
for their
explain
benefit.
why you use some products, explain and why you do certain things that way, because there is an explanation for it. So, so yeah,
Yeah. Okay, so I think we are done for today. Thank you so much. Thank you, everybody. Thank you, Trish.
yeah. Thank you
Please
for
feel
being
free to reach
here.
out to any of us. There are the emails, Trish emails or corporate emails, our phone number. So please feel free to reach out anytime. Thank you, Trish.
Thank you, Kelly, and thank you all for being here. See you next time.
Yeah, hopefully. Bye bye.
Bye bye.